Good afternoon. Thank you for joining us. I'm Janelle Heinrich, the Director of Public Health, Madison, Dane County. I am joined here today by County Executive Parisi and Mayor Rhodes Conway. Today, I am excited to share cautious optimism about the state of COVID-19 in Madison and Dane County, to outline the ways we are thinking about the health of our county and announce a leap forward for community businesses and activities. Since the beginning of this pandemic, we have been anticipating the impact of COVID-19 vaccines on our communities. Vaccines are a foundational element of a public health response to infectious diseases. Vaccines have nearly eradicated diseases like polio and have prevented other diseases from spreading widely and causing population-level harm. And they are critical to keeping our community healthy and slowing the spread of disease. As with these other diseases, the addition of COVID-19 vaccines are allowing us to transform the way we respond to this pandemic. Our public health work has shifted rapidly to focus on distributing vaccines in partnership with healthcare and pharmacy organizations. Already, we are seeing significant progress. Over 100,000 people, or 18.5% of people in Dane County, have received at least one dose of vaccine. That number is 68.3%, or over 2 out of 3 for those who are over the age of 65. And more impressively, 34.5% of this age group has already completed the vaccine series. Yet we know that not everyone who wants a vaccine has been able to get one. And we are working to give out vaccines as quickly as we get them from the state. But even at our current rate of vaccination, we are already seeing significant and hopeful progress toward our end goal of herd immunity. With this hopeful progress, as reflected by increasing rates of vaccination in Dane County, we are releasing a new version of Forward Dane to recenter public health decision-making around vaccines and herd immunity. Our core measures of how we are doing in Dane County will focus on the percent of people fully vaccinated, the percent of people at least partially vaccinated, and the percent of people 65 years of age and older who are vaccinated. We will also monitor the rate of vaccination and coverage amongst others who have experienced disparate outcomes who are at least partially vaccinated. This does not mean that we are abandoning the other epidemiological measures that we regularly reflect and report on. We will continue to factor in measures such as case counts, percent positivity, and hospitalizations as examples. As framed by the updated Forward Dane document, and in consideration of the improved outcomes we have experienced and sustained more recently, we are releasing new public health orders today that further relax restrictions in our county. Among other things, indoor gatherings in which food and drink are provided are increasing to a max of 150 people. Indoor gatherings without food and drink have a max capacity of 350 people, and outdoor gatherings are increasing to 500 people. Dine-in capacity for restaurants is increasing to 50% of seating capacity. Masking and distancing remain key mitigation requirements. We hope that even with these changes, we can maintain and improve upon our progress while we work to reclaim our pre-pandemic vibrancy in Dane County. I know that for many, this announcement may bring excitement and hope, while for others, you may be feeling fear and anxiety. Know that we in public health maintain our commitment to keeping our community healthy and minimizing the spread of disease in Dane County. We have learned through this pandemic that situations change rapidly, and we are prepared to respond quickly if necessary. As much as we can all work together to get vaccinated while protecting each other with prevention steps like wearing a mask and adhering to distancing and capacity limits, the less likely we will have to take steps backwards this spring and summer. Although we do not have certainty about the future, our evidence and our experience right now points to hope. We can only add more vaccines into people's arms, not take them away. Our older, vulnerable populations are well on their way to widespread immunity, which will help protect our hospitals from becoming overwhelmed and prevent deaths. Our healthcare and public health systems are more equipped to handle this illness now than ever before. If we continue on this path, we may see a summer this year that feels more like 2019 than 2020, but we need all of your help to get there. Please continue to wear your mask, keep distance from others, and get vaccinated when you are able. And together, we will see our community through to a new normal. Thank you. And now I believe County Executive Parisi will be speaking.
Thank you, Janelle. Good afternoon. Last night, we came together as a community to acknowledge the hardships and sacrifices we all have endured as individuals and as a community over the past year. Today, we can look toward the future with cautious optimism and hope as we further the process of incrementally and carefully reopening our economy and our community. We've been through a lot together, and our efforts are paying off. Today, we're entering a new phase in our journey, one in which we see hope for a better future, a future that looks and feels a little more like normal and a lot more hopeful, a future in which businesses can experience hope and renewal, a future in which life can begin to look a little bit more like it used to. And as we begin to enter this new phase, our commitment to the physical, emotional, and economic well-being of our community will remain strong. We still need to remain vigilant in our efforts to curb this virus as we vaccinate our population. Masking, distancing, and time-proven public health strategies remain important. Also as important is the fact that we are on a path to recovery and renewal and can look forward to a summer that looks much brighter than the one we last had. So thank you again for being here this afternoon. I'm going to hand it off to the mayor. Thank you.
Thank you, County Executive, and thanks everybody for joining us. This is really a significant step forward for our community and particularly for our economy. The last month's order change was also a step forward, and it has not resulted in an increase in illness. So while it's important for everyone to still take precautions, I feel comfortable that this order is the right move for Madison and Dane County. It's important to remember that public health orders focus on a population level. That means that these orders are framed with the question, what restrictions need to be in place so that we can protect vulnerable people, preserve hospital capacity, slow the spread of the virus, and prevent deaths in our community. That's a very different thing than an individual person making a decision for themselves about what is safe or unsafe for them individually. Right? Public health is focused on our entire community, but we still each have a responsibility to focus on ourselves and our families and to keep ourselves and our families safe. Just because gatherings are allowed doesn't mean that there's no risk at a gathering. And someone who goes to one or many different gatherings may end up putting themselves at a higher risk because of that behavior. Public health orders are the minimum that people need to do to keep our population as a whole healthy and to slow the spread of the virus. Each of us individually needs to choose what we're comfortable with and what level of risk we're willing to take. So I'm asking everyone to consider that. How comfortable are you with any given activity? Think about, before you engage in an activity, how many people are there likely to be there? Is it outside, which keeps it safer? Are people going to be wearing masks? Are people going to be taking off their masks because there's food and drink present? How long will you be there, and how close proximity will you be to people outside of your household? Each of us has to make these decisions for ourselves, and it's important to think through what you're comfortable with for you and your family. No matter what comfort level you have with risk, however, there are some basic things that we need you to keep doing to keep our entire community safe. We need you to keep wearing your masks. keep washing your hands, and keep staying 6 feet apart from people that are not in your household. And when your time comes, we need you to get the vaccine. Thank you, and we'll take questions from the press now. Please use the raise hand function, and we'll call on you. Not seeing any raised hands. There should be a button at the bottom of your screen if you have a question. Chris Hubbock has a question. Go ahead, Chris.
Hi, thanks for taking my call. I'm just curious, is this new plan more subjective, or is it simply acknowledging a subjectivity that was underlying the previous plan?
I don't know if I would use the word subjective. I think we have evolved and we have learned more about how to, what are the metrics that we need to use to respond. And there is, I guess, some level of subjectivity in that the thresholds are removed. But given the experience combined with data, we have that to use to help inform the policy practices and to be able to respond nimbly to keep that population support in place.
If I can just add to that, I think that one of the most important things to recognize is that we have learned a lot over the course of the past year here in Dane County, but also nationally. And there were some metrics that we were tracking that it just don't make sense to track. They didn't give us a lot of good information. And there are other new metrics that are very important now for us to track, particularly those around vaccination. So I think it's a really positive sign that we are making this shift now, because it really responds to the science, it responds to the data, and responds to the new information that we all have learned over the course of this past year. Other questions? Not seeing any other raised hands, so just give you all one more minute to see if there are any questions. And if not, then we will thank you all for coming and hope you have a great rest of your afternoon.